I'm Jenny King, I'm a urogynecologist and I'm at the Continence Foundation conference. We have one of these conferences every year. We involve nurses, allied health, other doctors, everyone who's involved in continence. I've been presenting at this conference on issues particularly related to female incontinence, the mesh issue for example, incontinence in older women, how we manage these women and how that's changed over the years, which is a particularly important area. We've also looked at investigations for urinary incontinence and how these have changed. My specialty area of interest is urogynecology, which is basically pelvic floor dysfunction in women, so prolapse and urinary incontinence. The real challenge we have with continence, I think, is that it's not seen as a legitimate disease. It's seen as a bit of an embarrassment or perhaps an inconvenience. It's not appreciated how serious a quality of life issue this is and also how important economically it is to the country. It's a huge economic burden on the community if we don't manage incontinence as well as we could. I think this relates to the issue of people seeing continence as a legitimate issue and as a real medical concern. We need to realise in this community that incontinence is more common than diabetes, it's more common than arthritis, it is probably more common than depression. It's not something that individuals can address. It needs to be recognised at a government level and at a health professional level. One of the big issues is that too many people will put up with incontinence because they're embarrassed, because they think it's a normal part of ageing, because they think nothing can be done. I'm not promising a magical cure, but you should seek help. There's the Continence Foundation has a helpline. You can talk there, you can talk with your GP. For younger people who are more used to computers, go online. There's lots of information, but don't just put up with it.